This is Steve Moreland, and we are doing another podcast episode focused on specifically nitric oxide. This is the natural upgrade. The natural upgrade is part of nature's pure blend. We're here to help you learn what you can do with tips, tricks, and techniques to help you understand how you can unleash your best self naturally. Today, we have a guest all the way from the United Kingdom, and I am very happy to have got a chance to meet and speak and get to know Dr. Usman. I'm going to start off here and give you a chance to get to know him, a little bit of his background, what made him passionate about coming into medicine. And then we're going to talk about nitric oxide and really deconstruct it and break it down so that you can get some useful tidbits that the doctor ordered just for you. So Dr. Usman, thank you for being with us today, and give us a little background where you're at. You said it's cold there right now, and what's going on today?
Yeah, hi Steve. Thank you for having me on your podcast. It's actually very nice just getting the messages across, and just education is something that I'm really passionate about. And there's a lot of pseudoscience, a lot of information is very complicated, complex, and this is something that I really like, just breaking down the information for people that they can actually digest and they can just take away with them and will actually meaningful impact to their life. So yeah, a little bit about me. I am a UK-based physician. My main specialties is gastroenterology and hepatology. I'm a member of the Royal College of Physicians, London. I've got a bachelor's degree as well. And yeah, I've got more than 10 years of research experience, and I've got more than 30 publications in peer-reviewed journals. And yeah, this is, as I said, writing, research, education is something that I'm really passionate about.
Thank you, sir. I really appreciate that background. And what we're focusing on today is something that, as I've got into and started peeling the layers of the onions back and understanding what is nitric oxide and how does it apply to this, what I would say, a chronic condition. I don't know if it's still the number one problem of humans across the planet, specifically probably more in the Western world because of our diet. But the thing with hypertension, high blood pressure, is that still number one on the list that's a problem for us?
Yeah, definitely is. And yeah, we have always read that in our medical textbooks, and probably everybody knows that it's a silent killer that it remains there in a sort of a grumbling fashion until you end up having one of the manifestations of the high blood pressure, whether it could be an MI or it could be a stroke, and a multitude of other problems that come with it. And yeah, I think just popping a pill is very easy, but I think education is most important, because I think when it comes to hypertension, in my clinical experience as well, and I think most of the doctors and all of the healthcare professionals would agree to us, is that the lifestyle is becoming more important in terms of your blood pressure and blood pressure control. And when I say lifestyle, I'm talking about what we are eating in terms of whether we are exercising enough or not. Because our diets, that they are full of foods that trigger inflammation.
Sure.
They don't have any antioxidants, that's the first thing, but actually have the substances that would actually diminish any of the antioxidants that we actually naturally have in our sort of bodies. And they're full of preservatives, chemicals, and we don't exercise as much as we should do.
Of course.
And then that smoking and stress as well. Everybody very stressed. And I think all of these factors, they have a sort of an additive effect. I think these lifestyle factors are the top when it comes to poorly controlled blood pressure in modern day time.
Multifactorial, so combination of failing to manage the stress, and stress coming from everything from relationship stress to occupational stress to commuting stress to financial stress. You stack all those together, and then you end up with, I guess you would call, less nutrient dense food products. And if you add in the ultra processed version, you're killing anything good that was left in there because there's too much packaging around it.
Yeah, Steve, that's 100% true. Yeah, I think the amount of the food that we are eating, actually, it's very difficult to actually classify that as actually food.
Right.
A processed blend of God knows what.
Sure.
And actually, that's what I tell people that just start reading the food labels. If there is something in the food labels that you can't read or pronounce or you don't understand, that's not good for you. And I actually do that sort of exercise. And I do that very often, that whenever I'm buying something, I just flip onto the food label side of it. If there's something that I don't understand, then there is something not good for yourself. That's
Sure.
definitely.
A friend of mine told me one time, and I don't know if you've heard this before, is that if you just stay in the perimeter of the grocery store and don't go down the aisles in between, just go to the produce section, get your meats and proteins, maybe on the back aisle, maybe even some milk and cheese products, maybe some dairy, and go on to the checkout and bypass all of the ultra processed stuff. You're going to do yourself a whole lot better.
Yeah, 100%. That's true. Yeah, I can talk hours about it, but yeah, I think the fact of the matter is the closer we remain to the nature, the better. The more processed things that are coming into our lives, into our diets, the more havoc it's gonna wreak on our.
Sure. So when we get to something where you have an individual that comes in, a patient, and you do the blood pressure cuff and you start seeing what the baseline is starting to set. So when you're saying high blood pressure, hypertension, that is not something that just started last month.
Yeah.
Usually, how far back are we talking about a lifestyle that is now manifesting itself as high blood pressure?
So when we talk about blood pressure, there are very actually rare instances in which a very young patient, say somebody who's in their 20s, would actually come in with a sort of high blood pressure. Those patients or those individuals, they have actually some genuine causes, or either hormonal problems, they have a problem with their vasculature, their vessels, their kidneys. Those sort of cases, blood pressure is what we call secondary hypertension. But majority of the cases are what we call primary hypertension. We call it idiopathic hypertension, which we don't know. But we know, as we are understanding it better, it's because of the lifestyle. And it's actually in 40s and 50s that you start to see people coming in with sort of hypertension. I think that it actually starts in your late 20s, early 30s. That's when sort of the things are starting to catch up. But I think the trends are shifting because as the new generation, because I remember the first time, I am from eastern part of the world. The first time I was exposed to fast food was when I was like 20 years old, right?
Right.
But now kids are exposed all of these things when they are like a couple of months old.
Indeed.
I think that these trends are going to change. And I think, as I said, now we see individuals in their 20s and we think of rare causes of hypertension. But I think in the next decade or so, we're going to see a lot of more young individuals coming in with these problems. Actually, we have started seeing this.
Okay.
Individuals in their 30s, early 30s, presenting with MIs. That was unheard of. And I think this is something, all of those sort of decades of poor health, poor diet, poor just exercise, a very sedentary lifestyle, that adding up. Yeah.
Yeah, absolutely. Sure. So do you see at least a correlation with nitric oxide deficiency having a correlation to this chronic hypertension, high blood pressure?
Yes, excellent question. And I think we don't talk about that much. Even as doctors, we don't talk about that much. We talk about nitric oxide only in the context of like heart attack, when things go to the extent that the damage is already done. We don't stop talking about nitric oxide when there is actually you can prevent these problems from progressing to the point where you actually end up having heart attacks. So a little bit about nitric oxide. So nitric oxide is basically one of the chemicals that are produced by your vessels. Okay. So what it does is that it dilates your blood vessels. So think of your heart as like a pump. So it's a pump that it's constantly pumping blood out of your heart. And if that pump stops, life stops. So because the heart is pumping blood into your vessels. So if your vessels are very narrow, then that pump will have to work very hard to function. And this is what nitric oxide does. Nitric oxide relaxes your blood vessels very nicely so that the heart doesn't have to work very hard. In addition to that, it has got a lot of anti-inflammatory and immune sort of mediated roles as well.
Really?
Yeah, in general, nitric oxide, it is crucial to your what we call cardiovascular health. So anything related to your blood pressure, your heart health, like preventing from myocardial infarctions, from stroke, from kidney disease, it's crucial. It's actually the key component that we don't talk about much, actually.
And could you, what I would call fancy, or the medical industry, even though this was a Nobel Prize winning discovery, I think in 98, if I'm right,
Yeah.
it seems like the general medical industry itself doesn't talk about this as I guess, from a preventative perspective. And why would you imagine that?
Yeah, 100%. As I said, I don't think there is a lot of discussion around it. Now, I think we can go around the rabbit hole of big pharma, and he's just creating problems and then just creating a set of people who be hinged onto your products forever.
Sure.
You don't want to give them a solution that could actually prevent them from getting to the point the damage is irreversible, because you have to understand, once you have an MI or myocardial infarction, a part of your heart is pretty much dead. You will have to, it might recover a little bit, but with time, there will be repercussions of it. Same as stroke as well. If you have stroke, you might recover from it, but we see that in clinical practice. It's a very rare instance in which your recovery is 100%.
Mm-hmm.
And I think we as medical professionals, we are not very good at talking about prevention, because again, it requires a lot of rapport building with patients, just spending time that we don't have. And yeah, why would the big pharma actually sell you something that doesn't actually benefit them? But on the other hand, they can create a group of 1 million patients which are tethered to their medication.
Mm.
Yeah, it's again a multifactorial, multifactorial discussion. I think it's.
Oh, I agree. Yeah, it's not a simple discussion, but it certainly seems like there's a smoking gun there too often that goes, if we had just educated the population that there's the body, if I'm correct, doctor, it produces a certain level of its own nitric oxide, especially while we're younger, and then it starts falling off as we age. Is that correct?
Yeah. 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 As I said, it's produced by the vessels, and in the like anything in the body, all of the hormones, anything that is produced in the body, there is a peak to it, and then the levels will fall off. You start to fall off in your 30s, and then it accelerates further in your 40s. But this is what is mentioned in the textbooks. But as that, because we are seeing a very massive irregularities in our dietary habits, in our sort of physical activity, stress levels, alcohol, tobacco use, it's off the charts. So I personally imagine these numbers are very skewed, and I think it's starting to happen very early. And that's why I think we are starting to see people with general blood pressure, heart problems, and a variety of different problems in very early life.
Wow.
Yeah, because the thing is that, as I said, nitric oxide, it degrades quite quickly inside the body. So it's not like it's an endless reserve. So if you're loading your body with toxins, with free radicals that we call it, free radicals or reactive oxygen species, that's what we call it. Or oxidative stress is an umbrella term for it. You're producing a lot of oxidative stress inside your body that will attack a lot of your nitric oxide. And then whatever reserves you have, it's going to just be burned up very soon.
Got it. So it's eating them faster than your body can naturally produce it. So the next thing we would do is doctor's orders. You should go take at least a brisk walk, maybe after dinner or first thing upon rising in the morning. And then again, like you said, how often do the patients follow through, even with the doctor's best orders? Yeah.
Yeah.
And then, so we have the ability for the body to create through exercise some nitric oxides, I guess you would call supplements, right? Or
Yeah.
supplementation. Then we can go to our diet. And like you said, if we're
Yeah.
eating less complex packaged, ultra packaged foods, we're eating more cruciferous like beets and other things like that. There is some nitrates that convert there. Am I correct?
Yeah.
So,
So yeah. So I think you're very right, Steve. So I think the way that I always tell my patients as well, and I think everybody who's listening to this should go about, and whenever anything related to the health is concerned, just try with natural things first. Of course, there's a lot of adjuvant and a lot of additional things that you can do, but again, all of the additional things, all of the pills, everything that you're going to take is going to wear off. It's basically building all of those habits that is going to stay for the rest of your life. So yeah, diet, as I said, just cutting back on all of the processed things and all of the things. I think, as I said, the rule of the thumb is just start reading the labels. Just if you don't understand a thing, there's a that you can't pronounce, it's not good for you.
Sure.
Start eating more nuts, berries, fruits, all of the superfoods that you read about. Because as I mentioned, it's not just about having enough antioxidants in the body. It's the first thing is don't introduce anything that is going to build up the oxidative stress inside the body, because then the nitric oxide is going to be degraded. So what these food substances and everything they're going to do is that they're going to first put a stop to it. And then they have got a lot of antioxidant elements in them. And some of them have nitric oxide triggering substances in them as well. So in three different ways, they will help together to improve the level of nitric oxide in the body. And then exercise, of course, regular exercise, as smoking, cutting back on smoking and alcohol. So I think these are the four important things. And then if you have done all of that and then you just want to go to an extra mile, then a quality supplement would something definitely be looked into.
So when you're talking about supplements outside of diet, exercise, and cutting out the bad stuff that we already know we're not supposed to be doing, there are two that I understand are amino acids that are, I think one of them's arginine and the other one is citrulline. Could you give me a little chemistry background there?
So basically it's a very complex pathway as to how the nitric oxide is produced inside the body. But what you need to understand is that these two amino acids, you rightly said, the arginine and citrulline, these are the two key amino acids. And actually there is a lot of research behind it that instead of taking them individually, if you were to combine them together, they have a lot of what we call a synergistic effect. So instead of just increasing or adding the effect, you actually compound the effect. So what arginine does is that it's a direct precursor to nitric oxide. What it means is that it directly degrades into nitric oxide. You can think of it as a quick boost. So it quickly turns into nitric oxide, giving you that quick nitric oxide, but it's going to wear off. If it's going to produce a lot of nitric oxide very quickly, it's going to wear off very quickly as well. But what citrulline does is that it breaks down into arginine and then it turns into nitric oxide. So it gives you that sort of a reserve inside the body. So you can imagine that if you combine these together, it's going to give you a major boost, and then it's going to give you that reserve inside the body as well. It's going to keep on turning into nitric oxide over time as well.
So combination together maybe is a time released element but as you said, the gas, once it goes into nitric oxide, it dissipates very quickly within the body. So this kind of helps it prolong that effect. So you get increased stamina, increased energy due to the freer flow of the cardio system. And then you get a quicker recovery as you're resting so that you feel better the next day.
The thing is that, so as I said, the things that I've talked about so far is the one extreme that these are the kind of things that you will see once the nitric oxide sort of reserves inside the body are completely diminished, heart attacks and strokes and stuff like that. But how to tell, what are the telltale signs you're running low on these reserves? So things you rightly said, fatigue, easy fatigability, that you're always fatigued even with minor activity. Your exercise tolerance reduces quite significantly. And then your circulation, you start to see problems with your circulation, just very cold hands, cold feet, and just constant headaches levels. And then, blood pressure, ECR, if you are very young and you are seeing blood pressure levels that are not expected in your age, then this is one of the early signs that you're running very low on the nitric oxide reserves.
Understand. So this is a lifestyle, like you started off at the very beginning. I love the way you kind of preface that. This is not a quick fix. This is something that our bodies need on an ever increasing basis as we age, as we put up with more stress, as we fail to ensure that we get the best diet, the nutrition that we need. Then those are ever increasing requirements that we would have to supplement simply because we can't rely on the status quo. It doesn't work.
Yeah.
I understand. Okay.
Yeah.
I appreciate you've given me some great insight. I love the flags that you gave here at the very end to help viewers and listeners know if they're feeling those cold and stiff extremities, they're feeling maybe even palpitations or something like that. They should difficulty going through even minimal level of exercise, whether it's walking or not even doing something like a HIIT program. But if they're having problems with those, then they should seek a medical professional.
Yeah, 100%. So yeah, I think these are, I think in my clinical practice, these are actually alarming levels of individuals. If you actually have any cross section of society and you start asking people these questions, you'll be alarmed as to how many people have these problems.
Wow.
And actually, yeah, I ask that quite regularly in my clinical practice, and I'm actually alarmed as to how many people actually answer yes to and all of these questions. So yeah, it's very there is no sort of test that measures nitric oxide levels, but as I said, these are some of the telltale signs to look out for. And yeah, as you rightly said, if you have any of those, then probably it's time to start taking your health very seriously. But because yeah, your health is everything. If you don't have health, then there is no point in having anything else in the life. This is at least this is what I believe in. And
Agree.
but yeah, this is definitely something that everybody should look out for. And yeah, just go for a checkup, have a proper frank consultation with the healthcare professional, and see what things they can improve in their life and what changes they can make.
Outstanding. Well, I want to come back at a different time and we'll talk about inflammation because it sounds like that nitric oxide could roll over into some other different concepts that I'd love to get down into the weeds. All of us are suffering from some level of inflammation just due to lifestyle and poor diet. And it's an ongoing increase, like we're talking about the compounding effect of small failure to take care, self-care over decades. And then we end up having the manifestation of that as some type of problem now. And what you're saying is if we take the diligence to pay attention to smaller, incremental, earlier events like our nutrition and not consuming things that are harmful, a little bit of exercise, stress management, then the combination or the compounding effect over time, we flatline that. And I'll use that word intentionally. We kill the potential of problems that we could have down the road. But if we disregard it, just because we don't feel it today doesn't mean we're not going to suffer tomorrow.
Yeah. Very nicely summarized, Steve. I think that's the crux of the whole discussion that we have had so far. And yeah, exactly. Little sort of baby steps. It's going to lead to a cumulative and a lot of synergistic effects, which you might not see the results in a week or that's another problem that I see. I think we are all very impatient.
Yes.
And we all are. We just want a pill that solves a problem right away. But yeah, as I said, whatever pill or whatever you're taking, as soon as you stop taking it, the problem will come back.
Mm-hmm.
You could look for a sustainable and a long-term solution, and investing in yourself. There's nothing better than that. You can't get long-term than that.
Totally agreed. Dr. Usman, thank you. You have been so kind to share some insights with us this evening, and I appreciate you sincerely for that.
No worries. Thank you, Steve, for having me, and I hope we can together some other time discuss something more and share my experiences and my expertise on that on another topic, maybe some other time.
Absolutely. I'd love to do it. And again, thank you for your time this evening, sir.
No worries. Thank you. Sorry.